Good afternoon. Welcome and thank you for joining us for an important discussion. The reason I say that this is an important discussion is we're going to be focusing on an aspect of healthcare and data that's misunderstood, it's misapplied, and it's often not discussed, and that is cybersecurity and data protection. I'm delighted to have two of the leading authorities on this topic. Today we have Melissa Hathaway. Melissa is the president of Hathaway Global Strategies. She served in two presidential administrations, leading the comprehensive national cybersecurity initiative for President George W. Bush and spearheading the cybersecurity policy review for President Barack Obama. She's got a unique skill set and expertise. She understands the way companies work. She understands the way the governments work. And her real claim to fame is she sits on the board of directors of what I like to think is one of the best think tanks in the world at CIGI. We also have Michaela Mosca. Michaela is the founder of the Institute on Quantum Computing at the University of Waterloo, a professor in the Department of Combinatorial and Optimization of the Faculty of Mathematics, and a founding member of Waterloo's Perimeter Institute of Theoretical Physics. The way I think about Michaela is he's been doing quantum computing since before it was cool. He is a genuine expert in the area of quantum computing and cybersecurity. The way we're going to proceed, we're going to have a quick round of opening introductions from our panelists, and then we're going to jump right into questions. It's not often I get to speak to a presidential advisor and an expert in quantum computing, so I've got some questions that I want to ask. I know you have questions that you want to ask, so push them through the platform, and we'll get to as many of your questions as we possibly can. So let me stop there and first turn to my colleague, Melissa Hathaway. Melissa, over to you.
Thanks so much, Aaron. It's so good to be here. And I think that when we're talking about the protected data in healthcare, it's important to start to think about and address the dark side of innovation. We're all very enamored with our technologies. We love it because it gives us access to new information. We have the potential of the technology to really change and modernize our lives, to give us access all around the world and to participate in a forum like this today virtually. And so we need to really think about the risks and the unintended consequences of the dark side of the innovation. And the pandemic showed us that the digital transformation of businesses is not a choice, but it's an imperative. We have new business models that are emerging. All of us are using QR codes now to scan for the menu at the restaurant, and we're using QR codes now to enter across the border. We're seeing intermediaries being removed from the equation. You can have an actual direct conversation with your doctor over a platform, and you're starting to see new things, and especially in healthcare. Robots are being used to improve outcomes. We have remote visits and diagnostics over Zoom or a telehealth or telemedicine. We're using connected devices to monitor our health, our heart, our sugar levels, our insulin levels, et cetera. And we're starting to see a new way of unlocking the value of the data so that we can, in fact, live a healthier life and reduce or control healthcare costs because we have a Fitbit or we have a watch that is monitoring how many paces we take and the like. So when you start to think about, the internet and these connected devices, in theory, these wearable and implantable devices are going to provide patients and providers with, these new remote diagnostic tools and perhaps save the healthcare industry more than $300 billion. But the challenge is that so few people understand the risks or that dark side of the innovation. In fact, 1 in 3 healthcare providers were victim of ransomware this past year, and due to phishing emails, unpatched software in their enterprises, and exploitation of the software, 45% increase year over year. We saw a ransomware knocked healthcare systems offline in Ireland and here in Canada. And where ransomware that wiped actual systems, and we had to rebuild all the servers and all the distinct systems. And it brings about a whole new way we're thinking about incident response and disaster recovery. We need to think about the speed of innovation and how it may drive exposures for those medical devices that are containing off-the-shelf software that has not necessarily been thinking through security of networks or the vulnerability of those medical devices. In the last few years, we have seen pacemakers recalled from Abbott Labs. We've seen Johnson & Johnson recall. We've seen Medtronic recall, whether it's scanners or their insulin pumps, and it starts to bring into a question of how we're thinking about these devices that we're embedding in our bodies and in our society, and how they could in fact be exploited. And then we also need to start to think about the data itself. We're trying to monetize the data. We're trying to diagnose what's going on in society with the data, live healthier lives, but also try to solve and cure challenges. But we need to better understand what is the data is being collected and why, where is it being processed, how is it being stored, how is it being protected, who has the right to transfer it, how long is it retained, and when and how is it retired. But at the end of the day, don't you want to know as a citizen or a consumer how and who owns that data? Is it any longer yours? There's new regulations and legal frameworks that are coming out all over the world to try to address this Internet of Things and the cybersecurity measures, the breach notifications and health applications and connected devices, and how we're expecting companies to protect those data. And we're also seeing new compliance regimes emerge around the world. And I look forward to our conversation today on how we're going to address some of these challenges going forward. Thank you, Aaron.
Super, thanks for that, Melissa. And I really want to come back to this idea of wearables and consumer grade technology, because what is health and data is now being walked around on your wrist and everywhere. So we'll come back to that. But Michaela, before I go to you, I just wanted to situate this conversation, because this is not an academic or an esoteric issue, right? I've got some notes in front of me, and as I was prepping for this, Newfoundland and Labrador recently suffered one of the worst cyber attacks on their healthcare system. It's been referred to as the worst in Canadian history. Some of their systems were completely shut down. Some of them had to be rebuilt, and it took weeks. So think about the context here. We're in a global pandemic, and healthcare systems are being shut down for weeks. That is not acceptable. And in this context, the data records of 2,541 patients were accessed. Some of it appeared on the dark web. So this is what's happening right now. Michaela, over to you for your thoughts.
Yeah, I like the way Melissa framed it. In the quantum sphere, we sometimes call it happy quantum, and then the quantum safe angle. But back to the health example, the more we can get a handle on and understand the so-called dark side, as Melissa's calling it, the more we can embrace and take advantage of the opportunities. The less we understand, then one of two things: we don't fully benefit from all the positives if we're too scared about the dark side and we don't understand it. We're not prepared. We say, look, we can't. I'm not going to do that online. Then we lose opportunities. On the other hand, if we just naively, like Hayden put it, we just embrace putting everything in cyberspace without really understanding the security implications, then there's all sorts of potential negative, consequences. So how do we properly manage these two at the same time, right? And one of the challenges that I've been working on, in my early days, I started really in the code making business, code breaking, for the aim of, objective of making stronger codes to protect all these cyber systems, is balancing the tactical and the strategic, or fire fighting versus fire prevention, as we sometimes put it, right? Because you have to do both. But you can't, but of course you have to fight today's fire. That will definitely get your attention. But if we're not proactive enough, eventually we're going to lose. I mean, we're not going to be able to keep up with the fires. So we have to somehow continue to be thinking strategy while we're fighting today's fights, right? Wars are won before they've even started. So if we're not thinking ahead, it's very clear, how this, it's not the details, but it's not going to play out well. For humanity and civilization and democracy, if we don't better get a grip on what I would say we sometimes call cyber resilience beyond just cyber security, which we tend to equate with the today attacks, which again, of course, we have to deal with, but we want to be better positioned to deal with them later. So one example of where we have to anticipate, so quantum is one example of an emerging tech, just tremendously disruptive, but not in a necessarily negative sense, to have offer many advantages to many sectors, including healthcare. But it will jeopardize the current foundations of our cybersecurity, the cryptography we use to protect the confidentiality, the access, the integrity of that data, right? We don't want people changing the data either, but obviously the privacy is something, something we worry about. So we want to get ahead of that. Maybe I'll elaborate. Do you want me to talk a bit more about that now, Aaron?
No, you know what? Why don't we jump in for questions, actually, if that's okay? Yeah, I was just thinking of your example. Do you know the Maginot Line, right? Right? When you're thinking of the Maginot Line, you were talking about the war analogy, and I worry that we're setting up policy frameworks that are in the Maginot Line. And for the benefit of our audience, after World War I, which was a trench war, the French decided to make the best trench ever, and it was called the Maginot Line. What they didn't anticipate was airplanes and tanks. And so while we're having this conversation, it's important to project out, because where the technology is now is not where it's going to be. And actually on that, Melissa, let me pick up on something that you wrote for CIGI some time ago, because as in preparation for this, it really resonated. You wrote in your essay, Patching Our Digital Future. You said, high-profile cybersecurity incidents of recent years are symptomatic of the attitude that continues to dominate the development and commercialization of digital technology, in which companies strive to release products as quickly as possible and worry about security flaws after they've already been developed. Ultimately, the paradigm of field it facts and fix it later is what we're dealing with. Melissa, what did you mean by that? Talk to us a little bit more about how that plays out in the digital health space.
Yeah, so field it fast, fix it later. That is the IT industry and hardware and software broadly. This is their approach to the marketplace. They get rewarded for being first to market and for market share. And they are not penalized for the inherent vulnerabilities that are in their hardware or software. So from a medical device community, this is starting to change, because we are bringing about, at least in the United States, liability and mandatory scrutiny of these medical devices in particular, those that like a pacemaker or an insulin pump, things that are going to be inside your body, not necessarily the wearables yet, but the inside your body. That they have to go through a security review. Security has to be part of the design principles and the like. But and in the United States, the wearables, how they're collecting data, how they can sell the data and other things is also starting to come under scrutiny from the Food and Drug Administration and such. So there are some areas that are beginning to move on in the healthcare space. However, hospitals and institutions where your medical providers are all running back office software that's Microsoft or Oracle or Cisco that have a cadence of a monthly or quarterly or a patching cadence. And what does that mean? Well, it's a vulnerable software. And so Microsoft averages about 100 patches a month. Oracle averages 400 a quarter. And so these medical institutions, these offices, the hospitals, the providers, they have this whole back office infrastructure that's vulnerable all the time. And so that's where your protected health information is. That's where very valuable data is being stored, even COVID research, among other things. And so we have to have a framework that starts to address this, this community, the ICT industry, that is the backbone of our digital lives. And there's a lot of digital exposure there because they are not fielding well-engineered products. They are not doing third-party code review. And therefore, we are subjected to the patch cadence and how well the institution, the office, the provider is keeping up with this bad software. And it's incumbent upon government officials to start to bring about consumer safety protocols, consumer advocacy protocols that holds this industry accountable for making sure that they deliver better devices and better software and hardware to us so it doesn't cause a safety and health concern.
So Michaela, if I went home and I looked at my pillow or my mattress, there would be a tag on that said, do not remove under pain of law until it gets to the final consumer, and it'll enumerate the materials that are used. That is a consumer safety principle. It's designed under consumer safety law. Now let's talk about smartwatches and fitness trackers. So here we're pulling all these metrics, and I'm not convinced the same requirements are there. And let me ask it to you this way. I want to talk about surveillance capitalism, right? So there's that old saying that if you don't pay for it, you're the product, right? So we don't pay for a suite of these things, and that's so that they can commercialize our attention and sell us stuff. But now we're actually putting it on our body, and we are creating data around our own personal health. So let me ask you this: who's the primary beneficiary of this type of monitoring, and what do we need to be thinking about in terms of the way that these companies are engaging with individuals and their what is ultimately their health information?
Well, this is sort of a privacy question. It's whoever is obviously offering you this product or service, so-called for free. But there's a wide range of business models for monetizing this information. It's evolved a lot in the last decade or so. There are a lot of, it's not as easy as it used to be. It's not so much, well, you sign the EULA, so I'm going to do whatever I want anymore. GDPR has changed the landscape quite a bit. So things have changed, I would say improved. There's still a long way to go for those sorts of issues. I'm more looking at the longer term implications of data that maybe is secure today, we're assuming is secure today, but might not be, or we know it won't be. We know it'll be vulnerable at some point when these quantum technologies are available.
So let me pick up on that same thread for you, Melissa, because you're right, Michaela, this is at the nexus of privacy and health, but it's also security. It's also data protection. It's also data commercialization. So there's a suite of public policy issues at play here, and consumer protection on top of it. So Melissa, where do you come out on this when we talk about that interplay?
Yeah, well, I think that we have an immediate issue on just the data protection and privacy that is the existing technology. We have the emerging technologies, the wearables that are generating an awful lot of data that you as a consumer or as a person are using to monitor your own health. But then so is the app is actually collecting that data and sending it elsewhere. And you automatically usually are opted in to that sharing of the data, and there needs to be a public policy discussion and or a consumer protection conversation about that. Should it be an automatic opt-in that my data gets sent to whatever, wherever it is, and it could be for medical research, I would be okay with that. But if it's for selling me the next product, then I'm not necessarily okay with that. And so we need to have an understanding of the use of the data, the rights, who owns it, how is it going to be transmitted. And then you have the over-the-horizon technologies that Michaela is talking about. And it's not just quantum that could actually disrupt how we actually encrypt or protect data, but it's going to be AI and artificial intelligence, machine learning, and the way that the algorithms are constructed that can introduce bias in how that data is actually used, or decisions are made based on the bias behind the math or behind the model. And so I think that a public policy debate has to address the current, the emerging, and then the future, the over the horizon issues. And that requires a lot better conversation of what's going on, what does it mean to me as an individual, and now what do I need to do about it as a government, as an institution, as an industry, et cetera.
So I got a hot pursuit for you, Melissa, and then Michaela, I do want to turn to quantum because I think that that's a looming threat that we need to address here. But so really what you're talking about is collection, use, storage, protection, and distribution of data. And what I'm seeing is a bit of a patchwork just developing. So, federal, provincial, local governments, Europe doing its own thing. Is there a way where we can actually better coordinate so that we don't end up with a thicket of various patchworks and various policies?
Well, we already have a thicket of various patchwork and policies, whether it's data protection, data privacy is defined very differently among all of our jurisdictions, cross-border data flows. And I think it's not just the collection and the storage and the dissemination, et cetera. You really have to address the ownership. That's probably the number one question of who owns the data. it's my data, it's my personal health information. And then I have to have, what is the right of dissemination of, whatever app or whatever doctor or, institution that has collected it. And we should create that framework around ownership. And then that would start to then determine the collection, the dissemination, and all of those other things. But the patchwork already exists. We are already not interoperable across borders and across provinces here in Canada. The privacy frameworks here are not harmonized in Canada. They're not harmonized in the United States. And then cross-border data flows from country to country are not harmonized. And so we have already a patchwork that is unlikely to be untangled.
Yeah, and I'm always seized by the question of cui bono, who benefits from the data, right? And so ownership is a complicated thing, and it's basically a legal construct in this world. And the legal, speaking from on the legal side, it is not very good. And there's a story that I tell, and Michaela, I'm going to come to you on quantum in 1 minute, but let me just tell the story. There's a company in San Francisco that owns a whole bunch of souls, immortal souls. And you would say, well, how is it possible that a company can own someone's soul? Well, one day for April Fools, they snuck into the terms of service that if you clicked I accept, then they would forever and forthrightly own your immortal soul. The point here is that we've built a legal construct on consent, on a consent-based model principally. And it's a lie. No one reads that stuff. No one knows what it says. No one really knows what's happening to the data, and no one really knows who owns it in those commercial transactions. So it's a solid point, Melissa, that we're going to have to get to the bottom of. And Michaela, it's all set to get a whole lot worse with quantum computing. So as a starting point, can you just tell us, like in plain English, what quantum computing is and why it matters in this conversation?
Yeah, and so just to put into context, your previous question was really about, the uses and abuses of that data by design, right? And it's already super complicated, and there's many policy issues and human issues involved with that. So systems are designed for certain people to use the data. Some of the uses are more open and transparent than others, and it's a very complex set of challenges that we really need to handle better, even though I think we are doing it better than we were a decade ago, but there's still a long way to go. The quantum threat is really, there's external actors who can then access this data and do many other things way beyond what vendors and other folk might be doing with it through the design, the actual design products. So let me now back up and explain. There's a lot of emerging technologies. Quantum is largely viewed as one of the most disruptive ones on the horizon right now. It's not even on the horizon anymore. It's really unfolding in real time right now. And it's simply put, we're harnessing a new framework for physics that was discovered over 100 years ago. And over the 20th century, we understood, we were trying to learn how it worked, but by the end of the 20th century, we're starting to harness it, be able to build technologies out of it. It's kind of like how many years ago we understood electromagnetism. How electricity and magnetism were all part of the same thing. Okay, that's great. That's interesting. Who cares? Well, now we can do wireless, wireless communication. We built the entire ICT sector out of being able to understand and harness the principles of electromagnetism. We're now harnessing the principles of quantum theory, which allows us to do many things: more precise imaging, right? More secure communications, but it also gives us an astronomically more powerful computing platform, which can solve certain problems, not any problem, with astronomically fewer steps than we previously thought was even possible. So some problems we previously thought, well, this will take 1 trillion years if you go through all the steps to solve it. Actually, you don't need that many steps. You can do it in an hour. And one of those problems is breaking the public key cryptography we currently use. We use it to guarantee the integrity of data, to know that that's really Melissa's message coming to me, right? And to establish keys that we use to encrypt our health data. So very fundamental primitives, tools in the digital era rely on the hardness of some problems, which quantum computers can completely crush. So we have a problem, and we need to fix it. Right? And I can elaborate now on all the challenges of fixing it and why we want to get.
You're on a roll. This is great.
Okay. So we have to fix it because you don't get to choose. You get to opt out of the quantum era, just like you don't get to opt out of the information age. right, or the computer age. So it's coming. It's already here. It's just going to continue to unfold and accelerate. And we have to prepare to excel in it, to prosper, to be healthy and free in that era. And so we know these codes. It was a blessing that we knew in 1994 that these codes would be broken. So we've had decades to prepare. We're not completely prepared yet. We got to, we've been preparing, but we have a long way to go. And we're certainly not out of the woods, as they say, because retooling all the fundamental plumbing of our digital infrastructures, which we're continuing to build. It's not like we're done and we're fixing the bus while we're driving it and just building a bigger and bigger edifice. And we have to fix the wheels. So we have to fix the very internal engine and so on, because that's where the cryptography lies. It's just horizontal that underpins everything. It takes years to do properly. And if you try to rush it, well, there's many scenarios. If you're simply not ready in time, then systems collapse, right? Because the information, well, first of all, past secrets could be compromised. Information is very vulnerable. All the confidentiality is vulnerable. But we're also talking about control and integrity. Being able to, these embedded devices, how do you authenticate? How do you control these things? Well, cryptography is a fundamental part of that. If the cryptography crashes, that it's really the availability of the systems can crash, but also the safety of these systems can crash, can be compromised. And these are not one-offs. These are not, spear phishing attacks, which are obviously super serious, but this is very systemic. This is the digital master key. So we obviously don't want to reach a point where the front doors are basically wide open to almost anyone who wants to get in. If we try to rush, if we don't do this proactively, if we don't manage this by design, then what? Well, rushing is very expensive. We're going to make a lot of mistakes. Systems will crash simply because we rushed. Bad quality assurance. Furthermore, when you rush software out the door, as Melissa was already mentioning earlier, there's going to be so many security vulnerabilities in there that who I affectionately refer to as the loser hackers, you don't have to be that brilliant to take advantage of security. You don't need a quantum computer. It's the usual stuff, except we've just made it much more easy for the hacker. We're already losing the war, and we're going to make it easier for them because we're going to make even more mistakes as we rush out the foundations of our crypto. It doesn't have to be that way. I don't think it's going to be that way, and many people around the world are working on it. Like our goal is to make the advent of a quantum computer a purely positive milestone in human history. Here's all the great things we can do with it. That cyber threat you guys were talking about, non-event. We want it to become a non-event. To make it a non-event, there's a lot of hard work to be done. And I also think this whole exercise, I think, has highlighted a lot of the fundamental problems that Melissa's pointing to. We get what we reward, and these long-term impacts are not internalized and not accounted for today. So we can make the quick money, and all the problems, well, that's going to be someone else's problem, right? It's a moral hazard in some cases. We're not properly costing this and putting it into our real-time calculus in making decisions about how we're going to secure our systems and what systems we're going to deploy. So there's a lot of lessons to be learned by this quantum exercise. I hope this is an exercise and everything works out fine and we're resilient against the quantum threat. I hope we do it proactively, and we're more resilient against other threats, because if you rebuild your foundations carefully and cautiously, they'll be more resilient against other unexpected threats, more agile to respond to other things. And I also hope that this whole journey is a lesson for how to deal with other emerging threats.
Let's make quantum computing boring again, in other words, right? And also what I'm hearing you say is an ounce of planning is going to be worth a pound of remediation. So we've got 2 minutes left. I want to give you the final word before we wrap up.
Well, I agree with what Mikhail said. It's we need to have a long-term strategy and invest in the de-risking of the technologies and what we want that future architecture to be. We have to think about the architecture with safety in mind first, resilience second, privacy third, security is a core component of that. And I think that really requires our leaders, both corporate leaders and government leaders, to have a much more sophisticated conversation about what I would say is, what's the current problem, what's the emerging problem, and what is the over the horizon problem, so that we can be proactive and invest in the safety and resilience of our future. And that is which is table stakes. And people like Mikhail and I think are probably talking every day to people, but it's not enough, because we need to be able to give enough of the talking points to the leadership so that they can do the talking as well. And so, that's going to require more mainstreaming of these topics at the national and international level.
Super. And thank you so much to Melissa and Michaela for a fascinating discussion. Thank you for joining us. Please remember to click over to section 2.8 for the concluding remarks. The platform does not do it automatically. If you don't click over, you'll be stuck looking at me and Michaela and Melissa, but you want to go over for the concluding remarks. Thanks to the University of Waterloo for putting this conference on, and thanks to my colleagues at CIGI for such a fascinating discussion. Melissa, Michaela, a pleasure as always, and we'll see you soon.
See you soon.